Thanks for having me. So I'm here today to present on behalf of a very, very great team and to just give you a very, very brief overview of the work we did in describing trends in incidence, prevalence, and survival of breast cancer in the UK. Special shout out to everyone who couldn't join. Nicola, Ed, Danny, Danielle, and all the other familiar face names that you see on the screen. So let's get into it. I think for all of us, it's one of the very, very common questions that we deal with. Those of us who do or constantly doing studies or deal with research question, understanding the burden of the disease. How big is the population of the patients? How many patients have the disease? What's the prevalence of the condition? How many new patients are diagnosed? What are the trends and what's the survival of these patients? For those of you who work in oncology, you see it even more. It's one of the most commonly asked questions. What is the prevalence of non-small cell lung cancer, subpopulation of subtypes of different cancers? And it's surprisingly shocking, or it was for me when I started doing a lot of this work, that how little information is available in the literature and how hard it is to actually synthesize the available information or try to pull out this information from what's available. So this is an effort, what I'm going to present from some of these activities that are going on, trying to tackle this specific problem. This specific work, basically, it's a population-based cohort study, very, very specifically trying to describe the incidence, prevalence, and survival of breast cancer between 2000 and 2021 in the UK using two primary care databases that I believe a lot of us are familiar with, CPRD Gold and Aura. I'm going to do a disservice if I want to go through the entire paper in 7 minutes and tell you what it is. So I'm just going to give you an overview and then guide you and tell you where you can find the many findings that this study has, many things that this study has found. In general, we looked into around 5 million males and 5 million females with over 18 years of age who had at least 1 year of prior data in either CPRD Gold or ORM. Overall, the study observed an increase in the incidence rate over time over the past 20 years, and the results and statistics were in line with the national statistics. Very important to find and very reassuring to us and also to clinical community to see that the work that we're doing is actually in line. We're not creating new statistics. We're able to look into prevalence of breast cancer in male and female, again, observing an increase in the prevalence estimates over time. And also we have observed increase or improved survival probability over the past 20 years, which I'm going to show you a little bit more in detail. Oh, slide is not moving. So briefly, this is what we see in terms of the incidence in the two populations with an increase in incidence over the past 20 years, with a little bit of a spike in 2004, which is due to some certain quality improvement metrics that were implemented in the general practitioner databases within the UK, with a drop in 2022. If we remember, the memories help. This is when COVID happened, and we generally saw a decrease in terms of incidence or like general burden, what has been reported and what was diagnosed due to this condition. Different pattern, but similar in male compared to female. And all the findings, as I said, is very much in line with the national statistics and what we have seen in reports that coming from the UK. In terms of prevalence, we observed an increase in the crude prevalence of breast cancer, both in male and female, with around the prevalence of around 2.1% in female at 2021, with peak around 70 to 79 years of old, and very low prevalence in male, but still similar pattern in terms of increase over age. Looking into survival, This is basically what we see, survival by age, but age general, looking into 1, 5, and 10-year survival probability. These are the estimates that we have with a general improvement in survival over time. A lot of these improvements in survival can be generally attributed to the new treatments that are available and better care of patients with breast cancer. Whether unfortunately the male has worse survival compared to female, indicating there's potential need for better improvement of treatment options in male population. This is very, very summary because I know we don't have time. There are a lot more results that have been produced and are available here. This is the link. You can go, the cohorts, the codes, all the results that you can go through, all available here. I highly recommend going through that instead of me telling you what we found in limited time. But the biggest question, actually, I want to talk about it for a minute, is it what's next? This is a first attempt. We've seen general statistics of breast cancer. A lot of us want to know what's happening to triple-negative breast cancer, HR-positive patients, patients with ductal cell carcinoma. We all know that we need a little bit more detail, a little bit more attention in terms of the detail and bringing it up. And a lot of you guys who are a part of the oncology work group have been helping a lot in building a lot of good resources and materials and making it possible. Making it possible to have the details so we can do create proper statistics on the burden of the disease. So what are we going to do now? And this is basically, I'm going to use this to tell you what we're going to do at the oncology work group. We're trying to put together an effort with the help of all of you to assess where are we with the oncology databases. Can we look into these questions in more details? Problem we have is that we don't know what information we have about cancer and the databases that we have. Do we have all the details on histology, on the metastases, site of metastases, and all those other details that we need? Do we have genomic variation to describe ER-negative patients or ER-positive patients? Can we identify the treatment and lines of treatment to properly tell how people are being treated and how they move from one treatment to the other? To address that, we put together a series of very, very simple query for folks who are our data partners and participants and those with oncology data to look into both their source data and also into standard data and tell us so that we can get information of like, what do we have the mapping been correct? What vocabulary has been used? Are the conventions follow? Are the data correctly located in the correct domain, and also to get a general prevalence of the concepts, cancer-specific concepts. These queries are very, very simple, and they will just give you counts, high-level counts, and nothing else. That would help us identify where we are with the data. What are the impediments with the mapping, and help us identify areas that we need to focus as the work group and help all the data partners to get to a level that we can address much, much more detailed information in oncology and move that breast cancer study one step ahead so we can look into the details. How can you participate? Everything is available in the oncology workgroup channel. If you want it, you can also send me an email. I'll direct you, I'll add you to workgroup, and I'll send you the script and also a detailed description of how to do it. This is our timeline. Our partners and all the workgroup members who have kindly agreed to participate are currently executing the query. It's simple. It takes a couple of probably 10 to 15 minutes to run. Share the results with us. We're going to put everything together and come to the workgroup meeting on October 24 for a live discussion, review of the findings, and help us put together a report that has all the impediments, the current status, impediments, and the solutions that we can work together. I look forward to having you all, and ping me with any questions. And sorry, I'm 3 minutes past. Thank you, Greg. Thanks, everyone.